Welcome. In this video, we'll be exploring nasopharyngeal cancer, a relatively rare but important type of cancer. We'll cover everything from its causes and symptoms to diagnosis, treatment, and the latest research. Our goal is to provide you with a comprehensive understanding of this disease. So, what causes nasopharyngeal cancer? While the exact cause isn't always clear, several factors are known to increase the risk. One significant contributor is infection with the Epstein-Barr virus, or EBV, the same virus that causes mononucleosis. Genetic factors also play a role, with certain ethnic groups having a higher predisposition. Exposure to certain chemicals, like those found in preserved foods, particularly salted fish, and cigarette smoking are also risk factors. Now, let's look at the pathophysiology. Nasopharyngeal cancer begins when cells in the nasopharynx, the upper part of the throat behind the nose, start to grow uncontrollably. These cells can invade surrounding tissues and eventually spread or metastasize to other parts of the body, most commonly the lymph nodes in the neck, and potentially to the bones, lungs, or liver. The cancerous cells disrupt normal tissue function, leading to various symptoms depending on the extent and location of the tumor. Epidemiologically, nasopharyngeal cancer is quite rare in most parts of the world. However, it's significantly more common in Southeast Asia, particularly in southern China. Other areas with elevated rates include North Africa and the Arctic. The disease tends to affect people between the ages of 30 and 50 and is slightly more prevalent in men than women. These demographic patterns suggest that both genetic and environmental factors contribute to its development. Recognizing the signs and symptoms is crucial for early detection. Common symptoms include a lump in the neck, often painless, caused by swollen lymph nodes. Other symptoms can include nasal congestion, nosebleeds, hearing loss, ringing in the ears, headaches, facial pain or numbness, blurred or double vision, and difficulty opening the mouth. If you experience any of these symptoms, especially if they persist or worsen, it's important to consult a doctor. Diagnosing nasopharyngeal cancer typically involves several steps. A physical exam is usually the first step, where a doctor will examine the nose, throat, and neck for any abnormalities. Next, a nasopharyngoscopy may be performed, which involves using a thin, flexible tube with a camera to visualize the nasopharynx. If any suspicious areas are found, a biopsy is taken for microscopic examination. Imaging tests, such as CT scans, MRI scans, and PT scans, are used to determine the extent of the cancer and whether it has spread. Nasopharyngeal cancer is primarily classified based on its histology, or the type of cells it originates from. The most common type is non-keratinizing squamous cell carcinoma, which is strongly associated with EBV infection. Other types include keratinizing squamous cell carcinoma and undifferentiated carcinoma. Knowing the specific type helps doctors determine the most effective treatment plan. Treatment for nasopharyngeal cancer typically involves a combination of radiation therapy and chemotherapy. Radiation therapy uses high-energy rays to kill cancer cells, while chemotherapy uses drugs to kill cancer cells throughout the body. Surgery is less commonly used but may be considered in certain cases. Treatment plans are tailored to the individual patient and depend on the stage of the cancer, the patient's overall health, and other factors. Targeted therapies and immunotherapies are also being explored in clinical trials. Unfortunately, there's no guaranteed way to completely prevent nasopharyngeal cancer. However, you can reduce your risk. Avoiding tobacco use is crucial. Reducing consumption of preserved foods, particularly salted fish, may also help. Maintaining good hygiene, including regular hand washing, can help prevent EBV infection. Early detection is also key, so be aware of the symptoms and see a doctor if you notice anything unusual. The prognosis for nasopharyngeal cancer depends on various factors, including the stage of the cancer at diagnosis, the patient's age and overall health, and the specific type of cancer. Early detection and treatment significantly improve the chances of survival. Recent research focuses on developing new targeted therapies and immunotherapies to improve treatment outcomes. Scientists are also exploring ways to prevent EBV infection and identify individuals at high risk for the disease, potentially leading to earlier detection and intervention. Continued research offers hope for improving the lives of those affected by nasopharyngeal cancer. Thank you for watching.